the anatomy of the scope, I suppose. So this one in particular is called a gastroscope. So it's used for scoping procedures like foreign body retrieval, endoscopy, colonoscopy, so it can go through the rectum or down the mouth. That's why it has to be cleaned really well, because we're using suction. So if we suck up fluids from the stomach, they can get caught in this tube or even all the way up in here. And then if we have that, the stuff will sit, it'll cement, and then you get like gross chunks up in here. And then you give the patient an infection, and then you've got issues. So talking about it, this section up here is called the boot. This is all of our electrical components. So the boot has a waterproof cover on it. Whenever we're dealing with water, it has to be either hooked up to this or it has to have the waterproof cover on it. If water gets in this, it will ruin the entire electrical system. So it's very important that this is on. You can actually see the little divots in it. So it just goes on and then it rotates. So it just clicks on, and then you might have to finish or mess with it a little bit, but it'll eventually go on and then it rotates. When it locks, you know it's good. So that's the waterproof cap. This is your electrical connection. So it's gonna go in with the longest piece on the bottom, straight in here. And then you've got your water connection, which are these two little knobs. And you've got your suction, which is the big knob on the side. So when you go to plug it in, or excuse me, the big knob's gonna go on top. So when you plug it in, it's gonna go straight in, and you'll see the two little little knobs up here too. They're, I don't know what you call them, but notches, yeah. They just go in, and you'll hear it click like that, and that's how you know it's good to go. You're gonna take off your waterproof cap. You'll take this part, which does not need to be covered. It normally just dangles right here. And this one has little yellow dots on it so that you can line it up with the yellow notches here. Hi. I was just going over setup. The only thing you missed, this is the electrical component. This part should always have a waterproof cap if you're dealing with water, or it should be connected to this. This is your suction port, the big knob on the side, and your water ports are the two knobs on the side. This one has a little yellow dot, which lines up with the yellow notches. So what I'll do is connect it just like that. And again, you might have to kind of mess with this one. Goes on like that, and then you rotate it until it clicks on. So that's how you know it's safe to deal with water in this system now. Now your water is right here. Only distilled water should go in this. And do we all know where that is, over by CT? Okay. And how this connects is you have to put it on kind of like up and down, like vertical, and then you rotate it, and then it clicks into place. So now it's secured. If you're having issues with your water, it could be due to the suction. There could be gunk up in the tube, because Dr. Ali had an issue with that last week. So I was just like, try suctioning it more and more, and it eventually worked. Other troubleshooting things, sometimes if you're not getting water, it's because this isn't on tight enough, because this is airtight. So you might have to tighten this or check more of your connections underneath. So you've got this little gasket down here, which has to be in there. That helps create the seal, and this just screws on. Now your suction, we always keep the same stuff on the part. It lives on the bottom. Now this part, the tube that runs from the bucket to the actual suction itself, does not need to be replaced every time unless you get gunk flowing into it, which shouldn't happen. If you get gunk flowing back towards the engine, that means this is too full. And if gunk gets into the engine, it will ruin it and the whole suction unit is gone. So I've got this hooked up. Now this one goes from the bucket to the patient, and you'll see the picture on the bucket. So this one will go right to the scope right here, and it just goes on. Make sure it's on tight again, because you want like an airtight seal. And then, so suction is all good, your water is all good, your electrical is connected, and that's it. So that's it for setup. The TV just needs to be plugged in. There's a little plug-in back here for these two boxes that gets plugged in, and then your suction gets plugged in. So once everything's hooked up, you can click the two power buttons, and then you turn your TV on with the remote. Okay. Now what you want to do is you want to make sure your scope is actually working and your camera's not broken. So you'll just pull this out. What I like to do is I like to cover it with my hand to make sure that the detail looks okay. It's a little fuzzy, but it's an old TV. A couple of things you need to know on this machine. One is air. There's a button called air. There's off and on. If you click on, it'll increase it from low, medium to high, so you can actually hear it coming through here. The air helps operate the suction and the water part of it. So I'll turn that off. Then you also have your brightness. So when you click ignition, that'll turn on the light at the tip of the scope, and you cannot turn it off unless you turn off the whole machine. But you almost always need the light. So hit ignition, and you'll see the light turn on. And again, this is part of kind of checking it out. So you just want to make sure your light looks okay and everything looks normal. You can shove it up to your nose, and you'll see, just like as if you're doing a patient. This tube is never to be bent at an angle more than this. If it happens, it happens. I mean, you know, when you're moving it, I kind of scuffed this up on the wall here because it's a tight fit. You just want to minimize it as much as possible. And we have these little syringes with little cotton gauze to help hold it when you're not using it, so it's not, you know, banging into things. If this tube is destroyed or damaged too much, there's fiber optics in it, so the repairs are very costly, so we just, you know, try to be careful with it as much as possible. And this can just go right in here. Oh, okay. So we've got the boot, which is all of our electrical stuff, which goes all the way up into here. And then we've got our controller. So we've got a few buttons on here. We don't need to worry about these black buttons. Those are mostly for the operator or the doctor. They change the colors on it. You can freeze the image. You can enhance the image, those kinds of things. These little knobs here on the side, they actually flex the scope itself. So it's important to know that when you're cleaning it, because you're going to need to move it around a little bit. And then we've got 3 channels, technically. There's really only 2, but there's 3. So you've got your blue and your red. So red is suction. So when you press this button, it's going to slurp up through the tube, go out here and into your bucket. And then you've got your water, which sucks water from here down here and into the patient. So if you're doing like a scope and the gut has like all kinds of food in it, you use water to kind of clean it out. The final one is called the biopsy channel. So we can squeeze grabbers, loops, that kinds of things through here to either retrieve foreign bodies, to get samples, whatever need be. And you can actually see there's like still some gunk in here from the last procedure because it wasn't cleaned. So we'll put that back on for now. Okay. So boot, controller. This hangs up just like this. You have to rotate it a little bit to fit it through here. And then it just kind of sits like that. This part, this is literally just called the tube. This is what goes into your patient. It has a light on the end of it. There's a little metal tip here. That's where the water comes out. And then there's a big little empty channel here where the forceps come out, or the loop, whatever you're trying to grab. So that is pretty much everything anatomy-wise. So talking about cleaning, cleaning should be done as soon as the procedure is over. So as soon as the doctor pulls that scope out, you should have all of your stuff ready. And that's what we'll talk about is supplies. So supplies that we need a bowl of enzymatic cleaner. Do we all know what that is? The brown cleaner in surgery. I use about 2 pumps in one of these little bowls, and then I just fill it with distilled water, and that's it. We have another bowl with just plain distilled water. This is for flushing it after we flush this. And then the final bowl is just rubbing alcohol, isopropyl alcohol. And the reason we use that is because whenever we're done actually cleaning it, we flush it with alcohol and air to sterilize it and help it dry faster. You'll need one of these surgical towels. It can be the ones that are up in the cabinet that aren't sterile. They don't need to be super clean. We're gonna need a brush. I just ordered these brushes. They're double-sided, so they fit the smaller scope and the big one, so they're pretty gnarly. You can feed it all the way through, and it does a really good job. We do not throw these away. They are not single use. We re-sterilize them. We're technically not supposed to, but I mean, it doesn't have any issues. So
Where do we find them? When do we need them?
good point. So your cleaning brushes are gonna be down here. So this drawer entirely is cleaning brushes, and it's also got aspiration catheters, which are more for that other scope, the smaller one. And you guys won't be using those. But just for reference, this is an aspiration catheter. And then this is a brush. Other supplies, we use these special syringes, and I keep them on the cart. I have them right here. But they're 60 ml wear slips, basically. So you've got the little slip tip. And the reason we use these is because they can fit perfectly into the little holes to flush the stuff out. So I'll keep that around. I think that's really it for supplies. Other stuff, I grabbed extra towels because you're gonna make a mess with this. It's really like, it's always a mess as you're dealing with water. So, some other things to know, other supplies. We've got our forceps. These are biopsy forceps, so they're used for taking samples. You can use them for foreign body retrieval. You're really not supposed to, but these are the only kinds of forceps we carry. And then the other one, which is what is mostly used for foreign body, is what we call a loop. So it's just a long plastic tube, and when you pull the handle back, you get a little lasso that comes out, and that's what you use to grab foreign bodies. So this one's really clean. And none of these handles really work great. You just kind of make it work. Okay. So we'll move into cleaning. Like I said, first thing, as soon as they're done with the procedure, you're gonna want to turn everything on, and you'll set up your stuff. I'll actually move this. I don't know why I set it there. Okay. This is helpful with 2 people if you're able. If not, it can be done with 1 person, but I've kind of banged the scope around a few times by accident. So I'll turn on my suction. It's gonna be noisy. So you can actually hear the air hissing out of this. What you need to do when you're suctioning is you cover the blue port and you press the red button, and you hear it kind of working. So if I take this, and I'll dip it in here, and just press the suction, and there it is. So a suction for about 3 to 5 seconds, and then once I do that, I'll switch over to the water, suction it for a few seconds. And the whole time you're doing this, you want to watch the bowl here to make sure it doesn't overflow because it'll ruin the suction. You just rinse it, you do this about 3 times each. Normally I would leave the suction running, but it makes a lot of noise. So after you kind of suction up your enzymatic in your water, that's when you grab the brush. So wherever I set it up.
Did you put it back?
Did I put it back? Okay. I just got a whole bunch of these, so. Okay. Now what we'll do is we'll open this up. So what I'll do first is I'll take it and dip it in the enzymatic cleaner. And now I'm gonna actually pop off this red valve, which is our suction. I'm gonna take this and I'm gonna feed it through. And what you want to do is you want to do small strokes about an inch long and slightly pull back, almost like you're scrubbing it. But you don't want to go too rough because you can scratch up the inside of the surface, which then hurts the fiber optics inside. So I'll go down. And again, it kind of helps if you like straighten out your tube because...
You want me to hold it up?
Sure. Yep. And then like that's where it comes out and it's dirty. So now with the red port, it's actually not going to come out of the tip of the scope because that's where that little metal tip is. So you're going to come to a dead end on this and you're not going to be able to keep going. And you are going to feed this whole entire brush pretty much. And if you have someone helping you and they're like holding the tube down there, you can actually feel the brush going through. Okay, so I'm at a dead end. So now I'm just gonna come back and I'm gonna do the same thing. Just half stroke brushes. Okay, you can lower it a little bit if you want. Okay, now that I'm through, I'm gonna come back, dip it in here. I'm gonna go through the blue one. And should be a whole lot of the same. I don't think it should come out on the other side. I could be wrong, but... Oh, that's right, you can't brush this one. That's what it was.
You said these two chambers were connected.
Correct. So the red and blue are connected, so as long as you brush the red one, you don't brush the blue one because it actually doesn't fit down in here. So these two channels are considered good.
And then okay, this one you have to take it off of it.
Sure. So then you pop off the biopsy channel cover, which is that little black one. And then you do the same thing here. This one was really gross, so I'm gonna kind of start at the top and clean the top out. And then I'll go back in here. Now this one is actually going to come out of the bottom because this is where you would bring like the graspers or the loops, so it'll come out of the tip of the scope. And you do the same thing, kind of rotate it, go back and forth. You want to scrub this one really good because this is where all the dirty stuff goes, like all the foreign bodies and all that. Biopsies. Okay, so when the scope or when the brush comes out of the tip down here, you always want to check it and look at any gunk, see how kind of dirty the inside of it is. Sometimes you'll get blood, vomit, whatever. You dip it back in here. Or, since we have the double-sided brushes, you could dip this one and drag it all the way through. But I just like to go back through with the same side. And again, you're doing the same thing. You're just brushing it back and forth while you're coming out. So I'm gonna call that good for the brushing. I can just go on the floor. Now is when we grab the syringe, and what we're gonna do now is we're gonna flush the ports with the enzymatic cleaner, and then we're gonna flush it with water. This is just to remove any of the debris that we loosened up with the brush. And this is where it gets like really messy, and you're gonna probably get water all over you. So into the suction port like this, and you probably wanna hold the scope kind of upside down. And you want to push slow because it'll squirt back out at you. And if you push too hard, the water can come out of this port or this port because they're all connected in a way. So I'll do that. So it's actually coming out of the suction tube because we're going through the suction line, and that's normal. So I normally do 3 flushes with the syringe for each channel. As long as you do 2 and you've brushed it, that's all I care about. Like, as long as you can get a quick clean on this, because if it's not clean, that's when we have issues. So it's coming out of the tip now, and it's coming through the suction. I'm just gonna do 2 for time's sake. I'm gonna do the water, Again, technically they are the same port, but just to make sure, because you know when you flush this one, you're not getting all the way, you know, at the beginning of the thing here, at the entrance. So flush the water, and this one's gonna exclusively come out of the tip, and this is the one that will make the most mess, is the water port. And you can't actually go too fast on this one, it won't let you because of that little metal tip at the bottom of the scope here, because it limits how much water flows through it. If you get water on the controller or the tube or the boot, it's okay because it's connected. You obviously want to limit water over here, but you're not going to get this soaked in any way as long as you're kind of doing it like I am. These are actually made to be submerged underwater too, when they're watertight like that. We'll call that one good.
Is that normal?
Yeah. It's just because
It's yelling at us. It's alive.
yeah. It's because there's like air and the tube is completely filled with water right now. But the cool thing is that you can just turn on the suction and click the suction button for a few seconds and it'll drain all of that out. So now the reason it's really, really, really important to flush this one really well is because this one is not connected to these two ports. So no matter how much suction or water you use, you're not going to clean this port. So that's why we have to manually flush it. And you can go this one, or you can go pretty fast with this one because it's a big channel, and water is just gonna shoot right out of this. So.
Oh.
Sorry, but yeah. So. And I like to watch it to make sure that there's like no visible chunks coming out. And it's normal if it kind of spits back out at you. Okay. Now we're just going to repeat that process with water. So again, this one's going to come through your suction hose and out of the tip of the scope. Yeah, it helps if you cover them sometimes too, like some of the ports. So that little noise you're hearing is one of these buttons up here, where I think it's me. I think I'm clicking the button, but that beep means you're just messing with the controller. It doesn't hurt anything.
So you do it 3 times with your the cleaning solution, and then with this you could just do it one with distilled water in each port.
I normally try to like do every port with cleaner and water at least 3 times, or 3 times. 2 times is okay. I mean, like I said, as long as
depending on the case and how dirty.
Yeah, that too. That's a good way to kind of judge it. Like if you're doing something really dirty, like I don't even know. I think there was a Yorkie that was done last week that had like a toad in it, and we retrieved it with this. So like something like that, you'd really want to flush the life out of it because that's pretty gross. We can cause nosocomial infections, so we cause the infection in patients if this is dirty, because if you're spewing dirty water in them, you know. But a lot of times, you know, if you're doing like a colonoscopy, I mean, you're kind of already in the butt. How dirty are you going to get the butt? So. And again, just for time's sake, I'm gonna skip flushing this one like 3 times, and I'm just gonna go to the next one. So this is the biopsy channel. Again, it's gonna come straight out of the tip of the tube this time. I think this one might spit out at you, so watch yourself. Also, since we're gonna be flushing with alcohol, I say you should always wear gloves. So now it's been brushed and flushed. Now is just the alcohol to make sure it's considered sterile. Normally what we would do is we would actually like pack this and gas sterilize it and all that, but we don't want to take the risk because there's a whole lot of processes involved with that. So what I'll do, since you're gonna help me whenever you're done, alcohol bottle. And we're just gonna do the same thing, but with alcohol. So yeah, I got it. So I'm doing the suction port. It's gonna come out of the tip and through the suction line.
And you do that three times?
Yep.
Okay.
So traditionally for each step, you just like flush it 3 times.
Yep. It's really as simple as that. Like I know this thing looks big and intimidating, and I know it's expensive, so I know it's scary to break it. But you're really not gonna break this thing unless you get water up in here, or if you like slam this thing around. All right, I'm gonna go through the water port now. This one is the one that's gonna spit at you the most because it's trying to force a bunch of alcohol through a tiny tube. I remember when I first learned this, I was just like on the ER floor, they did a scope and they're like, all right, it's your job to clean it. So I just followed the point to point and hoped I didn't ruin anything. And
So far, so good.
yeah, pretty much. So, I mean, if you ever have any questions, feel free to contact me. If I'm not available, try to consult the point to point that's taped to the top of that TV. I have it flipped over. But that one was written by Amanda Meeks, who was our old training coordinator. She used to do what Bobby Kelly does. She was a CBT, so she knows her stuff. And then I'm not going to do the water port again. So I'm going to flush the biopsy. All right, I'm going to call that good. Now, so we flushed it, we brushed it, we flushed alcohol through it, so it's sterile. So what I do now, the only thing in this syringe is alcohol, so I literally just like flush air through it a ton until the inside of the syringe looks relatively dry.
You just reuse it?
Yep.
Okay.
And this looks good enough because I mean you're never going to get the inside of that completely dry. So now what you do is you just flush air through it until you don't see any more coming out of the tip. And I'll get there actually. So I'm just gonna flush it. And this you can do aggressively. Like I have someone help me and I just shove air through it. And you can see me pushing air through it down here in the suction. The water kind of moves whenever I flush air in it. So this one, when you flush it, you can actually see the tube. If you flush it hard enough, you'll see the tube kind of expand. And you can hear it coming out of the tip. If you could hold this. Okay, so you got gloves on. Here, hold that up to like your wrist, so on your skin. So what I'm gonna do, like this is normally how I check it, or I'll like put it up to my ankle because my hands are full, and I just flush it as hard as I can. Did you feel water?
Yeah.
Yeah. So if you still feel water, that means you just need to keep flushing it. Over there 20 times. So now that's pretty much it. The only other thing you have to do is wipe down the tube because this has been in a gross stomach and esophagus. I use this, hold this here. Thank you. That's what the surgical towel's for. Honestly, you're supposed to use the enzymatic cleaner, but I ran out and so I'm gonna use alcohol. It's not gonna hurt it. So I just grab a little bit of alcohol on here, start at the boot or the end of the boot. I'm sorry, that's the boot. Start at the end of the controller and you'll just kind of go down here. It's like lube and all kinds of stuff all over it. Since it's really gross, I'm just gonna go over it again.
Could you wipe it with an Excel wipe?
Nope.
Okay.
I don't know. I mean, you probably could, honestly, but the manufacturer says to use enzymatic cleaner and alcohol. So.
Okay.
Yeah, it's probably good. Now, the one of the last things you want to do is just make sure your stuff works. So, I grab it and kind of maneuver the controller. Make sure that the tip flexes both ways. Looks good. Okay. So this is gonna go back to hang up. So this is kind of how I do it. I grab it and then let's see. Oh, it's because I always use this one, that's why. So see, that kind of angle is a lot, but it goes like that. So you can hang like that, or you can put it in the syringe like I did. This is kind of dangerous. Okay, now the stuff that you took apart. So we've got our water valve, our biopsy channel, and our suction valve. These are gonna soak in enzymatic cleaner just like you were using surgical instruments. They'll sit, honestly the manufacturer says they can soak for like 10 hours. So if you need to leave it, and for me the next day, or if you leave it for the next day to come in and clean it because it's busy, that's fine. These cannot go missing. Each of these pieces are a couple $100, not to be the fear factor of money, but it is a cost that we have to be conscientious of. So soak these in enzymatic cleaner. Once they're soaked, you just kind of, press them in the water, clean them, wash it with soap and water and a toothbrush, and then they go out to dry. Same with this one.
So how long would you suggest soaking them, like if we just were soaking it and we wanted to finish before?
If you're available and you have the time, soak it for 15 minutes like you would a surgical instrument. Wash it with a brush, soap, water, let it out to dry. Once it's dry, we pack them in the little surgical things. They don't get sterilized, and you can toss it back on the cart for me and I'll make sure it goes back where it belongs.
Would you prefer them to soak for longer?
Nah, it doesn't matter.
15 minutes is good.
That's normally how I do. What I'll do is I'll break down everything after I've kind of done the suctioning part of it, and then I'll carry these over, drop them in, go back to the scope, break it apart, put it away, come back and clean them. Your other things, luckily everything's pretty easy, like your loops. These also soak in enzymatic cleaner. The only gripe with these is the handle can't be soaked. If the handle gets soaked, it can rust it and it will make it so it can't open and close. Again, these are supposed to be single use. We clean them and hang them up to use again. If you notice that there is a gross amount of just gunk in here, it's got black water, yellow water, keep it to dry and let me know. You can hang it up over here on the cart because I check it every day. You can send me an email, leave me a sticky note, whatever. Send me a text, and if it's gross, I'll throw it away. If not, I'll clean it and reuse it. Same with the forceps here. If you use a forceps for foreign body retrieval, it soaks for 15 minutes. Don't get the handle wet. Wash it with soap and water. Everything hangs to dry. Whenever you hang it, I would prefer you hang it in the OR, the GP operating room. Have you all seen that big white cabinet in there? That's where all the scopes go, and I'll take you over there in a second. But
Do the heads on these detach, or you just have to leave them out of the fluid?
they just need to be left out. So I kind of wrap them up like this and put the actual tube of it in the cleaner, and I'll just dangle this over the side. And then, I mean, if you get a little water on it, it's not gonna hurt, but you just wanna avoid it as much as possible. So your forceps, when they're clean, they go in the tip top drawer. Again, this is your cleaning brushes, and then the aspiration catheters, which are used in that other scope. And then the loops go down here. Any other supplies you might need, like I said, the syringes go here. There's also one in here, or not the syringes, but other supplies. So like I've got extra pieces to the other scope in here. If your doctor needs a connection port, which they shouldn't ever need to use this, this is available. It's sitting up in here. That kind of stuff. IDEX bags, all that. Now, turning it off is fairly simple. But before I do, I'm just gonna suction through this a little more to make sure that I got all the water out of it. You don't necessarily have to because we hang it up to dry, but I just like to be kind of extra. So I'm gonna pop these back in. And they just literally just pop in. I'm gonna turn on my suction. And then I'm just gonna hold that red button again. I'm just gonna watch it. So there is still some water, alcohol in there. But it's pretty dry for the most part. So I'm gonna pull that out. That's kind of how you can like feel safe, make sure you're good to go. Any questions? No? Okay. So breakdown. Very easy. Just turn everything off. Power buttons. And then turn your TV off. Now this, you have to pull away and then you have to twist it down and it falls off. Water might leak out of there. That's fine because that's where the water port is. That's why we hang it to dry. Suction just pops right off. Honestly, we reuse the same bucket and tube because this portion doesn't go up into the scope, only out. So it's okay if you just wash this with soap and water and put it back on once you're done. And like I said, none of the suction tubing really needs to be replaced. So suction's good. With the scope, you're gonna twist this down and it's just gonna come right off. This can hang right here and this comes straight out. I always check to make sure there's no water on it or any of the electrical components in here. So you can see why if you get water in there, it would ruin it. Waterproof cap, always, always, always needs to go on when you're done. No exceptions. Again, you just kind of have to mess with it and then twist it. So this is your clean scope. So we'll take this. Again, you want to minimize bending it. Okay. So this is how I carry it. I've got my controller in one hand, I've got the boot and the tube, the boot and the tube in the other. There's no bending. And now we can go to the GPOR. So while we're here, I'll talk about the other scopes as well. But the way it hangs is it hangs just like the other ones. So I've got it all discombobulated. This will go like that. And this one is heavy enough that you don't have to, lay it in any type of way. But you just want to make sure it doesn't slam against the side here. And your tube will hang